This episode is brought to you by Spira Capital. Founded by 2008 Ron Brown scholar Ethan Monreal Jackson, Spira Capital is your fractional C-suite. Whether you're a startup or a venture firm, a freelancer, or a family office, Spira Capital gives you the scale, support, and stability to grow. Stop worrying about stuff like bookkeeping, accounting, FP&A, operations, HR, payroll and benefits, or your international workforce. Let Spira Capital run those for you so you can run your business. To learn more, visit spiracapital.co. That's C-O. Welcome to The Value of One, The Power of All, a podcast created by the Ron Brown Scholar Program. Since 1996, this organization has been investing in the next generation of African American leaders. And this podcast highlights the stories of the people that make this program special. I'm your host, Ray Pryor, 2015 Ron Brown Scholar. And in this season, presented by the Ron Brown Venture Lab, we're highlighting founders in our alumni network who are changing the world through innovation and entrepreneurship. We'll dive into their personal upbringings and backgrounds, the origins of their ideas, and the successes and challenges they've had along the way. Today, I'm excited to share my conversation with Tsikata Apenyo, 2014 Ron Brown captain and the founder and CEO of Volta. Let's just start with sharing a little bit about what Volta Health is, and then we'll continue to dive in.
Yeah, Volta, it's a digital front door for health and wellness on colleges for students, but then for administrators and other stakeholders work an operating system to be able to manage everything going on and have a big high level picture, as well as being able to automate and make things a lot more efficient. For students, we're mainly dealing with care navigation, helping them figure out the healthcare system, right? You're 17 years old and you just left home, and now you have to figure it all out by yourself, and that's tough, right? But then for the administrators, they've got thousands of young adults that there's a lot of compliance things that are needed, right? So whether it's immunizations or insurance or things of that nature, and a lot of that was being done manually until we came along and really automated a lot of things there.
What was the origin of Volta? I can imagine quite a few things in your background as well as that happen in the world that make this the opportune time to build something like this. But can you take us to maybe even not even the early days, maybe the pre-days? What happened, and what were you thinking about that led to, I want to build this platform for colleges to help take care of the kids?
Yeah, I mean, I'm an accidental founder. I never intended to be a founder. Before this, I was in VC, and trust me, I had a lot more sleep. I had more hair and everything. The pre-story, I would say, probably starts back when I was in college. I was student body vice president, and it was a really cool position. But during my tenure, we had a string of suicides on campus. So, folks that we knew, because it was a small campus, it was 3,500 students, and I knew that the administration was just going to be a little slow to act, just because that's just education. They want to be very meticulous and calculated. So I wanted to just do something in my own little way, and I started volunteering at a crisis hotline. And those are places where you talk to all sorts of people from all walks of life. Talk to people that are just lonely, elderly people that are just lonely and need somebody to talk to, or they may be a single mother that is concerned about interpersonal violence. And I took a lot of similar calls, but then there's one call in particular, and it was actually with a college student. I didn't know her. She was from somewhere in the South, but she had an incredible story. She was the first in her family to go to college. Her mom had been mostly incarcerated. Her father was terminally ill. So to me, she had already won the game of life, right? To be able to make it to college with all those stacked against you. But during her first few weeks, she got a UTI. And for a lot of UTIs, tend to be benign. But for her, coming from where she came from, she didn't really have a strong grasp on health literacy or what was just going on in general. So she did what a lot of kids would do, and then she went to her school's health center. But they didn't really provide her any help, and named her for things that she was doing in her life. And they told her that they couldn't get her in for 3 weeks. Right. So what started as a physical health condition morphed into a mental health crisis. And by the time that, she was seen 3 weeks later and walked out of there, she walked to a bridge. Right. And that's where she saw the number for the hotline. She called the number, and I happened to be the one that picked up and was just in shock how that could have happened. And there were so many times in those 3 weeks or 4 weeks that something should have been different. Somebody should have stepped in, or she should have gotten the help she needed. So that's what got me on this route towards medicine. I wanted to go to med school to be part of the solution, and was really fortunate, went to med school at Brown. And I think one of the things I quickly realized was they do a really good job of teaching you about COVID and the flu and all of that. But in terms of the big picture issues, that's just not what med school is designed for. So it made me want to take a step back and get an MBA. So I ended up going to Yale for an MBA program. And that's initially when I went there, I was thinking about doing healthcare administration or hospital administration, but then somehow left with a company and we had a payroll. And I was like, well, damn, I guess I got to hold off on residency for quite a bit. In terms of what happened, it was during my first year, and I was in this entrepreneurship class. So we were learning about the lean startup method. And as part of it, I sent out a survey to our 30-ish person class and just forgot about it. And 10 days later, I checked to see what the results were. And we had 4 shy of 1,800 students respond.
Wow.
Yeah. So what started in our classroom had spread to the law school, the med school, the undergrad, a ton of people. Right. And on one hand, it made me realize there's a pressing issue here. Usually when I get a survey, the first thing I do is like delete. So for people to fill it out, it says something. And as I was reading the responses, and it was just crazy how at a school like Yale, where there's ton of resources, you would think that the students that are coming there are of or background where they would understand the healthcare system, but they were facing the same problems 10 years earlier that my friends were facing in college, or people that I would talk to on the hotline. So that's what made me want to start something. And our mission at Volta has always been to increase access and understanding of healthcare. So at our core, we pride ourselves on our care navigation platform, which helps students navigate the healthcare system, where things are, how much it's going to cost, all of that. And over time, we've also built this compliance aspect of it, quite frankly, because we needed to keep the lights on. And it's led to something that I never thought about, never really imagined. But I wake up every day and I'm excited about life, about what I'm doing, and very few people get to have that feeling. So really happy with where we're at. There's always a ton of challenges, but it's part of the journey.
Yeah, yeah, we'll dive into those challenges for sure. Man, so I certainly can see what was supposed to be a project for a class that you're taking in your program turning into this really desperate cry of all of your fellow classmates that something needed to be different through that survey, and other experiences that you had validated that this is an important, crucial moment on campuses to get wellness right. As you drill down into this, what did you see on the university side or college side of what their systems look like? How anyone who is hypothetically has an entire infrastructure around doing this
Yeah.
still isn't, I mean, not that they're not doing their best, but still isn't doing as effective a job, at least as we would hope. What did you see on that side that presented the opportunity for Volta to be also a resource for them as much as it was for students navigating care?
Yeah, no, it's crazy. I think the thing is, when you think about a college or university, one, you think that they have a ton of money, right? And then two, they're educating the next generation, so they must be really forward thinking and all that. And it's not the case. It's just not the case in terms of a lot of the processes that we came in to fix were just being done by manually, pen and paper. Things that could and should have been automated were being done by pen and paper. I think part of the issue is that higher education is just really resistant to change. It's akin to a government job. Once you get hired by the government, you're good to go. So all you have to do is to not mess up. Bringing in anything new, innovative, you could possibly mess up. So I think the incentive structure there is it's a little bit misaligned. And then similar to having a government job, somebody might think it's not my money. So if we need to hire more people or if we need to do this or that, university is not ran like a traditional business. So because of that, I think over time cracks started appearing, but then again, not wanting to shake the boat, it's just stayed there, which is where we were able to see that opportunity and how to do two things at once. That initial mission that we set out to do, but then because of the information we were gathering from our care navigation platform, we then were actually able to help administrators out. So it was just, we crept into it. We really never thought about building a compliance platform, but we realized that a lot of the problems that they had, we just had the tools to fix it. And so we just needed to do a little bit of tweaking.
Well, I'll start with the simpler one that was near the end of what you said, and then we'll dive into the second one. First is, what are some of those compliance things that the institutions have to worry about? That's a whole world I don't know if many of us even know. I can imagine of some, but what are those things that even for them, I would imagine they appreciate not needing to do via pen and paper anymore? What are some of those tasks or things they have to keep track of?
And the biggest one is in insurance, and I'll get to that in a bit. But the first thing that we stumbled across was vaccination verification or immunization verification process, and has nothing to do with COVID. But I think a lot of students that remember being in college will remember that process in which once you get accepted, before you matriculate, you have to show that you've taken the Tdap, the measles, all this stuff. And when we came in, it's a pain for the student to have to gather all that information, but it's even worse for the administrator because for them, they have to verify all of this by hand. So they have to verify that it's authentic, that it meets the criteria, that there's just a lot of things that are involved in that. And we worked with the school, and previously it was taking them 5 people, 6 weeks of the summer to just manually verify 100 students, right? So and that's you're hoping that the students actually do it and turn it in. So that's a whole other problem right there. We were able to turn that 6 week process into 6 seconds. All right. So we started building these pipes and connections to various data sources across the country. And then what that led to is being able to automatically pool a student's information for a source of truth and being able to just check that off. So now you don't need those 5 people can enjoy their summer and be back in the fall. And then for the university, that's a lot of money right there that's being saved, money, headaches, etc. So that's an example of it. It's a really arcane thing. You wouldn't think about it, what's happening behind the scenes. So that was our first foray into it. And then we stumbled into insurance. And I used to work in BC, and one thing that my GP or general partner would say is that there's a lot of great ideas in healthcare, but who's going to pay for it? And oftentimes that's the insurance company. So very similar to this immunization process, there's something similar for insurance in which a lot of schools require students to have insurance on campus. And the rationale behind that is that you don't want a student to get hurt, go to the hospital because your student health center can't. If you break your leg, they can't do anything for you. So they're going to send you to the hospital. And then if you can't pay those medical bills, you're not coming back next year. And not only that, the school might also be at fault in terms of a liability situation. So that's the angle in which they're coming from it from. So students will submit their insurance information at the beginning of the year, and this is all students every year or every semester. And for the university, they either have to do the process that I just talked about with immunizations, manually verifying it, but rather than just a quarter of the students, you're doing this for all students. It's a logistical nightmare. So they would outsource this instead. Most schools would outsource this to health insurance brokerages. And so the brokerages, their real task when they come in is to help the school find the official health plan, right? So that's going to be what you're defaulted to if you don't have insurance from your parents or yourself or whatever. And they take a commission of for doing that. And then if they, go one step further and administer the plan, which means enrolling students or waiving them off, the commission would double. Yeah, double the commission of what they got is what they would earn on top of it. So it's a lot of money when you're thinking about there's two schools in New York. They're notable schools. One of them, their premium every year is $80 million. The other, their premium is 125 million every year. So we're talking about a lot of money. So when you're talking about a commission based on that total number, it's ridiculous. And they were able to charge that just because of it was a manual process. And we came in, automated that completely. And so we don't need a human calling the insurance company to verify that this coverage is on and it meets the certain requirements of the school and things of that nature. Not only that, we can check every month because some students might turn 26 and now they're off their parents' plan and now they're uninsured effectively or their plan lapsed for whatever reason. So it's a very unsexy thing. It's extremely unsexy, but that's what's really, that piece in particular unlocked a lot for our company in terms of we could now start working with insurance companies directly. Because some of the schools that don't have a broker still need this done, or we could even work with brokers as well because for them it is a lot of work. So if they want to just focus their attention on something else, they can subcontract it out to us, but then it still gives us the opportunity to work with the university directly. And for us, the way we think about it internally is that we're coming in with this compliance solution, but ultimately giving the path for us to bring on board this care navigation solution that for universities is a nice to have, but for a student, it could really make a huge difference down the road, right?
And it sounds like in your experience in NBC, you got that advice from a GP how hard innovating in healthcare can be, but you found a really creative way to offer an essential service to universities that clearly is a big market where it can be make a lot of sense for y'all to offer that or to work with people who offer that, but also as a means to take care of the type of person that you were receiving calls from on that health line, and that sometimes it requires that creativity to get in your door to do both or to not sacrifice one for the other. And that's, I admire that a lot. The second question I had was just about that healthcare innovation as a general hard thing to do.
Yeah.
Like you said, never short of ideas, but always short of who's going to pay for it, responsibility for it. Systems got to talk to each other. What do you think allowed you to find an opportunity to make things better on the campus side for institutions? Were you thinking about what would exist just in general in healthcare, and then how do you apply it to universities, or could you go reverse? Where, because I still have to call the phone to book my doctor's appointments every
Yeah.
single. I got to fill out the paperwork on paper every single time. I know that it didn't have to be that way, and so I'm glad to hear that students are getting that. What is different about higher ed than general healthcare that's allowed you to be able to innovate in this way? And maybe there are things you wish you could do that higher ed just said, no, I'm sorry, we're not going to change it, not going to do that.
Yeah, no, I don't think there's much that's different. I think a university campus is just a microcosm of society, right? It's a microcosm of what a small town would look like because they have a gym, they've got a library, a town's got a library, they've got dining halls, it's restaurants. So it's very similar. But I think the big difference for us is it's a controlled environment, which makes it a lot easier. And big thing just from a logistical standpoint, the way I think there's two entities in this country that can just tell you what to do and you just have to do it. It's the government and then it's universities. So if you don't want to get the Tdap vaccine, well, you're not showing up to campus. That's it. So there's just one thing or one entity that you have to deal with from a company perspective. But ultimately, it had to do with aligning incentives for the various stakeholders that were in place in terms of what did the schools need versus what did the brokers need versus what did the payers need. Each of them has a very different thing that they're getting from our platform, and it just took a lot of time to understand the system and understand how to align all of that to make sure that you're not stepping on anybody's toes, but then at the same time, you're still able to be solvent as a company.
Yeah, yeah, I can see that. Makes sense. And even though, like you said, there were things you're interested in that you didn't learn in med school, you likely had a deeper appreciation or just exposure to how different incentives can be in the same building, same hospital, same institution. But yeah, it takes time to figure that out.
And I think also just having gone to med school and done rotations, and I understood the healthcare system from the healthcare side of things. And I think oftentimes when people are trying to innovate in healthcare in particular, they might be engineers or they might be coming from the outside. And there's just some things that a doctor's not going to do. You might think that they should do it, it makes sense, but they're just not going to do it. So you got to be able to work around that and create a product that is actually useful. Because if the doctor's not going to do it, well, just forget about it. So I think that also was really helpful.
Yeah. On that, and going back to the results of that survey that you look at a week later, and there's thousands of submissions. What what was the first version of Volta, and how? What did you think was the first priority? Because I can see you sitting in your MBA class in year one after having gone to med school, seeing even all of these submissions. The fact that accessing care is frustrating isn't new, and so probably wasn't all that surprising to you. Even maybe the quantity of the response was. What did you see in that that led to we're going to build this thing? Because I'm sure it's evolved since, going from when you started to to what it is now.
Yeah, no, I sometimes will come across the first prototypes or like drawings of the platform and I just laugh because, wow, so much has changed. Initially, I was viewing everything from a student perspective. That's the entity that we wanted to help, we wanted to address. And so that's what led to our platform looking the way it did. And it was focused solely on students and it didn't really address any other entities' concerns whatsoever. And that shift started happening when just realized that this was, I don't want to say universities don't care, but it wasn't addressing their pain point. So, if you've got a twin sibling and they get a Christmas present or a holiday present, you don't care, right? What about mine? So realized that what we had was a nice to have for the universities. Because one of the things that I've known from the beginning is that there's no student that's going to pay for it. It's just not happening. I'm out of college and it's still hard for me to pay for a 99-cent app. It's just not happening. So because of that, you need to have the institutions cover this for their students, but it's just not essential for them, right? And it didn't really solve any pain point. When that realization became pretty apparent, that's when just keeping your mind open was critical. Keeping my mind open and just kept talking to customers, just kept talking to them. And then it was actually the immunization thing was the first thing that we really did for that was non-student focused per se. And it came out of a conversation with somebody at a university that worked at the health center, and it was during the summer. And she complained about how arduous this whole immunization thing was. And then she just kept talking. And I was like, wait, hold up. What did you just say? What did you just say? And she mentioned it again, expand on that, and she talked to the process. And I realized that we already had students were able to view their medical records within our platform. And we had built it in such a way that they could connect all their various electronic healthcare records and view it within our platform. So we already have that immunization information. All we have to do is slightly shift it and present it in a way that the school needs or wants. And that was it. That small tweak, because we had it the entire time, but we were just not thinking from their perspective. That got us down the road of making sure that we still have something that is important for the students, but you need to get out into the market. If you build the coolest thing in the world, if nobody wants to buy it, it's not the coolest thing in the world. It's the coolest thing in your life.
That's well said. Perhaps looking back on your journey, it seems obvious, but to pause innovation and energy around your primary focus, which was your students, to worry about these folks who, not to speak poorly of their work or their work style, but who are not doing very innovative, like you said, or sexy things,
Yeah.
but to use that as a way to keep Volta vibrant and alive and sustainable, I think is, it's not the sexy part of innovating and building a product and pivoting, but it is as essential, particularly when you're in such a, whether it's literally legally regulated or just logistically regulated or just
Absolutely.
convoluted space like healthcare can be.
Yeah. Yeah, no, and I think I tell a lot of people that ask me, whatever you think your initial idea is, that's not what it's gonna be. Because you might think it's fantastic, and it might be fantastic for you. But I think every founder, I mean, they might not admit it, but everybody goes through a pivot of some sort or multiple pivots. And I say, like, I understand the word pivot from every single which way, like, because this is something that it's your baby. You think about it so much. You're going to sleep and you're thinking about it, right? Naturally, things are going to evolve if you're thinking and really evaluating something to that degree.
Yeah, absolutely. Now, two more thoughts here. Two more things I wanted to get your thoughts on. One is, you know, of the time to build a product that is or centered around higher education between and related to health and
Yeah.
higher education and just and generally with the pandemic now 5 years ago, started 5 years ago.
Yeah.
And now with all of the recent changes with funding for higher education institutions, how has that impacted Volta? What of, if anything, of recent changes to the landscape around which how universities get financial support? Does that change anything for y'all or present any new opportunities?
It absolutely did. I have lost a lot of hair. My hair is a lot thinner because of everything that's got to happen. There's two things that can happen. I mean, I guess I'll use this anecdote. A lot of people say that the best time to go into the stock market is when things seem like it's all falling apart. Because it's eventually going to come back, and it's going to come back, and you're going to be on the right side of things because you bought in when it was low. So I think that's part of how we're thinking about it. Every venture needs some tailwinds of some sort. And before all this happened, I don't think there were really tailwinds per se, but now there are. And we've talked about how resistant to change higher education is. But when you need to change, you can change really quickly. And we have an advisor who has been in the higher education space for forever. And he told us there's been several times in history that people say that the ceiling's on fire or whatever it may be. After the recession, they thought education was over. And then during the pandemic, kids aren't around. How are you going to fund your school? This is the end of it. But in each of those instances, companies that came to define the industry were born out of it, right? Whether in COVID, it was mental health. And I think for us, one of the things we've been preaching about since we've added this administrative function is efficiency and automation and doing things in a much more efficient way. And now that needs to happen. It's not even we would like this to happen. At the school I was talking about earlier, who, I said that they needed 5 people to do their immunization compliance efforts. When their university, there was their president froze the budget. And the day that he or she froze the budget, at that time the student health center had 6 job openings. 5 of them were dedicated to immunization compliance. So they can't do it. Like, they can't hire people to do it, but it needs to be done. It's a compliance thing. It's a regulatory thing. So that is a door for us to be able to get in. Uh, then the challenge is the budget is frozen. It also applies to us. And so you get really, really innovative in terms of like how to just survive and advance. And for us, that just came with, I always say that it's a bad idea for me not to have anything to do. And I was on a plane and it was the middle of the day, so I couldn't sleep or I didn't have anything to do. There was no Wi-Fi on it, Delta flight. So I just had a lot of time to think. And I started thinking about what are the value incentives for these insurance companies. And from that, I realized that the insurance company would be more than happy to pay for it if, we did certain things for them, right? They would pay for it on behalf of the university. So now we have an even more powerful tool in which we can go to a university and say, this entire platform's free. And all we have to do is go to their insurance company and manage this enrollment and waiver process for them, which would have cost a lot more than what the school would have paid. And these insurance companies, I always say universities are irrational buyers. There's no sense to how they go about things. But an insurance company is a business. You know what their driver is, it's making money. So whatever is going to make money, they're going to do it. And it's also going to be a much shorter sales cycle. Had all this not happened, I don't know if we would have ever gotten to that stage of realizing that we should be going through the insurance company themselves.
Yeah, you find a way to be grateful, even in the things you wouldn't ever wish or pray would happen.
Yeah. No, it's crazy.
Last question before I let you go, that I'm asking to all the different founders we're talking to in this series, all of who are alumni of Ron Brown, all who have gone on to do amazing things, will do amazing things, but more importantly, could virtually do anything with their skills and their talents. You certainly, as somebody who could have easily been a doctor, could have easily used your MBA to do other things, could have stayed and on the other side of the table as an investor. Why, of all of the things you could do with your time and your talents, are you building Volta right now?
Yeah, that's a great question. I think I mentioned it before. I wake up every day and I'm on fire. I love what we're doing. I love my team. I love talking to customers and not just the schools, but the students as well. And quite frankly, there's just something that's different about your name being on the door. Your name's on the door. If you don't want to wake up, well, nobody else is waking up. So you just have to go get it done. And it's certainly not a life for everybody. But for me, every day is unique. Every day is different. For example, in medicine, it's an important job. We need doctors out there, but most of it is formulaic. You learn a formula and it's a decision tree of this is this, you do that, you do this, you do that. That's just not the case in entrepreneurship. You're really having to think deeply about how to make things work and build something new. And I think for me, everybody goes into healthcare to help people. And I'm helping a ton of people, but just from a different angle. Rather than being inside the pie and trying to eat out, I'm outside and trying to eat in. And being able to give our platforms, to hundreds of thousands of students, so that if in the unfortunate case anything were to happen to them, they can get the help they need. I think, that's going to make a much greater impact than the less than 5,000 patients I probably would have seen in my entire medical career. So, yeah, no, I think it's still about impact, but it's a different way of doing it, and it's just about following your heart, right? It's certainly on paper, it is the craziest move in the world. And let me tell you, anybody that went to medical school is a very rational person or they're very meticulous in their planning. So it's unusual to take this route, but it's just something that I felt was really needed. And if you're able to do it, why not?
Thanks for listening to this episode of The Value of One, The Power of All, a podcast created by the Ron Brown Scholar Program, presented by the Ron Brown Venture Lab, and sponsored by Spira Capital. If you want to hear more inspiring conversations like this one, don't forget to click subscribe on your favorite podcast platform. And to learn more about the organization, check us out at ronbrown.org.